anxiety. This is no medical advice. Anxiety. The symptoms can be headache and head pressure, insomnia and unexplained pain somewhere in the body, and also frequent passing of urine and weakness and listlessness. So, and in this book then is explained or said as a guess that it is normal to have anxiety for many things. And people, by things like job interviews or an exam or going on stage or something, they know where the anxiety comes from and they know where it comes from, and after that it goes away. They're saying no, anxiety which is longer, is chronic or longer and stays. That is about things, is their guess, that it is about things where they don't know where the anxiety comes from. So it's not that appointment at 10 o'clock, it is that they have a difficult financial situation or worry about their child or about housing or something else. And another main reason was conflicts, especially about loyalty. And the people was when said reporting that with the word stress, so having stress, or having conflicts with loyalty with people or something. And now, in this book is then said that the way basically people who have it should be encouraged to be active, because the reason is people get worried by why they are worried. They are worried and they don't know about what. It is not the 10 o'clock appointment or the exam. It is something they don't know, that they're still worried about it. That they don't have enough money because they still don't have enough money. We're going to be with over months, years, decades maybe. So if they now worry about why they are worried, it gets worse. So the idea, don't be worried or don't worry about it, is an idea, because when people are coming into a vicious cycle, they are worried why they are worried. They are worrying about why are they not worried, and they can't find it out. And explaining to people and knowing that anxiety, at least is that the idea where it comes from, that anxiety comes from things which stress the person, conflicts about loyalty, financial situations, worry about a child or whatever. Knowing that it comes from something like that helps the people not to get so much into that vicious cycle, to worry about being worried, and the anxiety doesn't aggravate. Now there's thought that people should be encouraged to be active, to accomplish things, to do activities, to do entertainment as matter of fact, just to do something, not to get introspective, not to think too much, not to be worried about being worried, not thinking about anxiety. And now the idea is now that the people over time overcome it, and most of the times because they get relationships which work with family and friends, and their situation improves. So the idea is to be active, whether it's productive in activities and jobs or just entertainment or something, not to be worried is the idea. To do some type of activity, and then to get a working relationship with family and friends, and maybe get enough financial situations on, and that tries them to get away from these causes which were there all the time, which cause the anxiety, like not having enough money or something like that, and to overcome the anxiety, understand where it comes from, and learn to handle it, or just be active and trying to resolve secondarily, without really even noticing it, the causes of anxiety. That is according to Keith Hodgkin's Family Medical Advisor book on the page 76 and 77, but this is no medical advice.